Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. So I'm here with Ben Miraglia, Dr. Ben Miraglia from New York. We are talking about comorbidities or symptoms that occur because of poor breathing and poor sleep. So Ben, let's talk about asthma and how that relates to underdeveloped jaws and poor sleep and breathing. And these kids that develop asthma at such an early age now, it's very alarming. So share with us a little bit about how this is affected by the way our jaws develop.
Sure, definitely. So asthma comes in as a fairly common symptom and condition in children. If we were to look at the CDC, you could actually find numbers. So we go to the cdc.org and we look up, hey, what's this incidence of asthma in kids? It turns out they have documentation that shows 9.6% of children have asthma. And so that's significant. That's a lot. So we're dealing with just under 10% of kids having asthma today. Direct relationship to the breathing. And so what we talk about is we're going to build a little puzzle around asthma related to breathing. So the nose breather. When you're breathing beautifully through your nose, well, the nose and the brain and the diaphragm all work together for the breathing process. So we got our nose right here, we got our brain right here. Well, the diaphragm is that fancy structure that's right underneath the lungs, and it separates the lungs from all of our intestines, basically. Well, the diaphragm moves up and down, and it's like a pump. So when the diaphragm goes down, your belly goes out, the diaphragm goes down. When the diaphragm goes down, it brings the air into the lung. When the diaphragm goes up, it pushes the air out of your lung. So basically, the air coming in and out should be related to the diaphragm moving up and down. And loosely, you could say belly breathing. Because when your belly goes out, the diaphragm went down, so you kind of shift things. Intestines are going this way, your belly goes out, your diaphragm goes down, the air goes in your lung. When you exhale, your diaphragm goes up, your belly goes back in. So you got this system running. Well, proper nasal breathing keeps all the ingredients in place to make sure the brain sends the signal to the diaphragm to move. So the brain has to signal the diaphragm to move for the breathing to happen with the lungs, right? Well, if we start to mouth breathing changes the ingredients. When the ingredients get changed, and when I say ingredients, we covered it in part 1 where we talked about oxygen, carbon dioxide, and nitric oxide. These three things are what are related to breathing. So we'll focus on the carbon dioxide, which we think is a waste product that we exhale, right? We breathe in the oxygen, we exhale the carbon dioxide. Well, it is a waste product, but we have to maintain it at a certain level because at a certain level, it's part of what makes the brain work the diaphragm right. So when the diaphragm is working right and you have that so-called vacuum pull of air into the lung, the air goes all the way to the bottom of the lung, then the vacuum kind of pushes back up and expels it out. Diaphragmatic breathing is perfectly healthy breathing because you use the entire lung. The diaphragm, when it goes down, it's like a vacuum pulling the air in. Well, with the proper nasal breathing, carbon dioxide, CO2 levels are maintained perfectly so that as they change a little, that's what tells the brain to tell the diaphragm to move in this cycle. Beautiful breathing, diaphragmatic breathing. Well, when we have nasal airflow compromises, can't breathe well through our nose and our mouth starts breathing. When the mouth starts breathing, it's a form of over-breathing. So now we're actually expelling too much air. It's getting closer to being hyperventilating than actual breathing. So when we're over-breathing and we're dumping out the waste product, carbon dioxide is leaving at too high a level, meaning it leaves behind too little. When we over-breathe through our mouth breathing changes the brain because the carbon dioxide level is too low. Basically, the brain is sitting back waiting for the right level to trigger the diaphragm to breathe. Well, you don't stop breathing, even though you're mouth breathing. But the levels aren't there to make your brain make your diaphragm move. So if your brain doesn't get a signal to move your diaphragm, there's a backup plan. The backup plan is it activates your chest muscles to breathe. So if you're breathing through your mouth, the mechanism becomes chest muscle expand and contract. So you become a chest breather. So on one side of this coin, we've got diaphragmatic or belly breathing. The other side, we have chest breathing. So it turns out mouth breathing delivers brain activity to make your chest muscles work. And when your chest muscles go in and out to kind of help air go in and out, you're working up higher. When you're working up higher, you don't get to use the whole lung. So chest breathing only uses like the top 2/3 of the lung. So the air only gets about 2/3 down, then gets pushed back out. So the air's going in and out quicker in a pattern that doesn't utilize the entire lung. Well, that pushes us into the category of, well, mouth breathing is chest breathing or chest muscle breathing. It's a form of compensation, and chest muscle breathing doesn't allow the lung to get the air into the bottom of it. So it's now a disuse principle kicks in. What happens to a human being when they disuse something? Well, if you don't use your muscles, if you lay down for 3 weeks, you lose your muscles. Muscle disappears. 3 weeks in the bed, right? If you don't use the bottom of your lung, well, you have fluid then retaining in the bottom of the lung. You start getting inflammation down there. This is your pathway to asthma. When we see patients with asthma, right away we think, hey, that's a poor breathing pattern. So we think poor breathing, we think underdeveloped jaws, mouth breathing. Mouth breathing is a pathway to develop asthma because now you're only using the chest to get the air into the top half or 2/3 of the lung, and you don't use the bottom of the lung. That's going to become a problem. Collected fluid that isn't getting turned over, and of course, inflammatory changes. So now you're going to have this inflammation occurring in the lung, and you get a diagnosis of asthma. So you get an inhaler. An inhaler can open tubes and make breathing better, but it's treating in the symptom category. Because ultimately, when we think about the difference between the diaphragm breathing and the chest breathing, we'd like to have the diaphragm do the breathing because it's the mechanism by which the air gets to the bottom of the lung. How do we get the diaphragm to breathe again? You have to have the right carbon dioxide level, but you can only have that level maintained in balance with nose breathing. Mouth breathing is what ruins the carbon dioxide, shuts off the brain signal to the diaphragm. So if you want to treat asthma in a causal category, let's say, what you would do is breathing retraining combined with jaw growth and development. Because if you could improve the jaw growth and development and convert a child to nose breathing, you have a really good chance of working their way out of asthmatic conditions. And because asthma is a little more severe than just poor breathing, you might have to incorporate breathing technique, because it's one thing to grow the jaws very nicely and have the room for the air. It's another one to correct the mouth breathing habit. So that's when we start introducing people like Patrick McEwen, who's a Buteco breathing expert and a former asthmatic, and I learned a lot from him. So this Patrick McEwen was a severe asthmatic as a child, and he went through all the Buteco methods to retrain his breathing to cure his asthma. Well, it turns out when you learn from someone like that, you learn that there is significant research out there that shows with breathing retraining, asthma can be cured at a very high rate, whereas with inhaler or bronchodilator therapy, inhaler therapy, you can improve the symptoms, meaning I breathe better, or I can breathe a little better now. So we don't get a cure from inhalers. What we get is an improvement in the breathing. That's in the symptom category. Whereas if we treated the asthma by breathing retraining to be nose breathing, diaphragmatic breathing, you can cure asthma. All of that research exists very nicely. And you have people in the Buteco breathing method world like a Patrick McEwen. He's written a couple of books that are really nice to look at. You could think about Close Your Mouth is one of them. The first book I read from Patrick McEwen was called Close Your Mouth. And it outlined the difference between nose breathing and mouth breathing and how asthma is related to these things. And then the other one I think was called The Oxygen Advantage. Making sure I got the title correct, referencing him. Yeah. The Oxygen Advantage. And as soon as you start going down that road, because I didn't invent any of this. I'm not a pioneer on a level of, hey, this is my stuff. I've learned from some of the people out there that had pieces of the puzzle, and when you put it all together and you start treating children, you start seeing, hey, if I treat the jaw growth and development and get that right, and then we convert to nose breathing, all of a sudden the symptoms fade away, and asthma is one of them. So I have had the experience over the last 15 years of seeing kids who had inhalers, had asthma, lose their inhalers and lose their asthma diagnosis and come out of it, and nothing was done other than we did jaw growth and development with nose breathing techniques to get them back to nasal breathing. Nothing else was done to change that. So we think about asthma as one of the things we learn from parents on intake forms, and we instantly relate it to underdeveloped jaws and poor breathing. In the asthma category, since it's a little more severe, we have to grow the jaws. We've got to get the jaw growth and development right, but then we might need one level more, which would be breathing retraining. So I mentioned Buteco breathing methods, and there are people who are trained to do that. One category that can help there is with the myofunctional therapy community. So to throw that out there, the title's long, orofacial myofunctional therapy, or orofacial myofunctional therapist. Basically, it's a specific type of therapy for the head and neck that can redirect musculature, behavior, and strength, as well as breathing patterns. So that community exists. They're out there. To say it loosely, I would say it's like physical therapy for the head and neck to make sure this is all functioning properly. And we do combine a lot of those techniques with our treatment. So we do jaw growth and development. We add the myofunctional therapy so the child gets this kind of comprehensive collaborative care. And next thing you know, we've got a child whose jaws are correctly positioned and growing, but then they've had training to make weaker muscles stronger, to make stronger muscles balance with those weaker muscles now being stronger. And then, of course, retraining from mouth breathing to nose breathing. The myofunctional therapy community is a big part of it. And now you kind of know in that very short description the difference between, what it means to have asthma or not is really related to the pattern by which you breathe, which is directly related to your breathing through your nose or your mouth. That's how the ingredients become imbalanced to trigger the body to function differently. And whether you're diaphragmatic breathing or muscle or chest muscle breathing, that's the difference where you are now in a category to have asthma become a rate of 9.6% of children today.
And how about in adults? Obviously, we know adults should be nasal breathing as well. If they have underdeveloped jaws, we can improve that. How does that relate to asthma? Or do you see improvements in adults as well with their asthma?
Yes.
Or?
So two different animals, the child and the adult, when you're thinking about the jaw bones. But the techniques are the same. In other words, we still need jaw growth and development. We still need muscle balance and therapy. We still need maybe possible a deviated septum corrected. But the idea behind in a child is the bone is softer like a wet sponge, whereas, now in an adult, that bone is the hard structure we think bone is. So in a child who's more moldable, it's a little easier to get the correction in a shorter amount of time and get a full resolution. Whereas in an adult, when that bone is mature, it takes a little extra effort and time to guide that growth of that bone to make a difference, and some more extra in the collaborative care category where the ENT might be involved as well as the myofunctional therapy. So with an adult, there are some additive things that go into it, but mostly we're dealing with the anatomy being underdeveloped. So same type of approach. We have to grow the anatomy, and we just have different tools and techniques to do it in an adult. Could be a little more time consuming.
But the adult can still see improvement in their asthma.
Absolutely. In fact, the author we referenced, Patrick McEwen, he cured his asthma as an adult.
Oh, it was as
So
an adult.
yeah, it was teen into the adult years. He wasn't cured early. He was a severe asthmatic for a very long time. And he works with children through adults. When you retrain the breathing, you can correct the asthma at any age. You just have to get back to diaphragmatic breathing. And getting back to diaphragmatic breathing can be through training of mouth to nose breathing, or through your anatomy, or a combination. So in my world, it's a combination of let's get your anatomy bigger and better for better airflow, then we get your breathing retrained as well. That's a powerful combination.
Yeah, it's interesting. And some of my functional medicine training, one of my professors teaching said, look at commercials for drugs. The actor or actress always refers to it, or maybe the narrator, as I took such and such for my asthma, or for my, what they want you to do is own it. This is yours. This is your asthma. You got to deal with it. We've got a pill here that will help the symptoms. So parents or adults, if you have asthma, don't get into this thinking that this is something that you have to live with. Because it's not. And there are medications that help, dilators, but you don't have to be stuck with one of those either. There are other ways to treat the cause that Ben was just talking about. So if you're 5 or if you're 50, you can seek alternative methods to cure this and not just treat the symptoms. So we'll see you next time. This has been Health in Harmony Beyond the Teeth. I'm Hal Stewart, your host. And I just want to say thank you for being with us and letting us share our knowledge and do something good for somebody today. Might be the only person that ever does anything good for them, and it might change their lives. You never know. We're signing off now. See you next time.